Hello medicos, I am Dr. Rao and now we are moving towards the part 2 of first chapter of cell injury and adaptation. In this part 2 we are going to see about cell adaptation, what you understand by cell adaptation and the hypertrophy. So what do you understand by the word adaptation? Adaptation is a process of change by a body or a cell to the external stimulus so as the cell or body could survive. So if you have a cell like this and it is receiving, yes, which type of stimulus will lead to cell adaptation? We saw in previous lecture. Yes, right. Those who have not seen that lecture, please go. I'm putting the link in the description. Please go and watch that first part, and then we will move forward with the part 2. So yes, what type of stimulus? It is a non-lethal, right? Non-lethal type of stimulus will cause adaptation in the cell in the means of changes in number, right? Then we have changes in size, then we have change in function or the change in phenotype. Yeah, all these will lead to the adaptation of the cell. So we should know that cell adaptation is a reversible process. What happens is, whenever there is a removal of that external stimulus, this cell which has undergone adaptation will go back to its normal state, right? So cell adaptation is a reversible process. It is a functional and structural response to the external non-lethal stimulus. So what are the examples of cell adaptation? The physiological example of cell adaptation is a pregnant uterus. So pregnant uterus is an example of hypertrophy and hyperplasia. Okay, so what do you mean by hypertrophy? What do you mean by hyperplasia? And what are the different types of hypertrophy, hyperplasia? What are the types of cell adaptation and their examples we are going to deal in this lecture series. Okay, so for now, just know that the pregnant uterus is an example of cell adaptation. It is a physiological example. Now what are the pathological examples of this cell adaptation? So there are 3 examples we are going to deal in the pathological changes, like pathological example of cell adaptation. First we are going to see in the chronic smokers. So what happens in the chronic smoker is that the ciliated columnar epithelium in the trachea and the bronchi is converted to non-ciliated squamous epithelium. See, ciliated columnar epithelium changes to non-ciliated squamous epithelium in trachea and bronchi. The other pathological example of cell adaptation is a cardiac muscle enlargement in the infarct. So what happens is, suppose this is a cardiac tissue section we are talking about, okay, and this is the infarct area which died and loses its ability to function. So to accommodate that lost ability, to compensate that lost ability of those cells, the surrounding cells, the surrounding cardiac muscle of that infarct undergo hypertrophy, and they say, okay, if you are not able to pump, we'll pump the blood for you. So this is what happens in the cardiac muscle surrounding infarct area. And then we have Barrett's esophagus. Barrett's esophagus is because of reflux acid from the stomach into esophagus. Okay, so what happens? Because of the constant reflux of acid from stomach into esophagus, the stratified squamous epithelium of the esophagus get converted into ciliated pseudo-stratified columnar epithelium. Okay, so this is what happens in Barrett's esophagus. But all of this, on the removal of the stimulus in the Barrett's esophagus or in the smokers, the changes will retrieve and the cells will go back to its normal form. Okay, so let us move towards what do you understand by hypertrophy. Okay, as the word suggests, hypo means increase. Okay, and trophy means size, that is increase in size. But one should know that in hypertrophy there is not increase in number. So the number of cell is same. Okay, so what is the mechanism of hypertrophy? Yes, the size of cell is increasing. So what is happening is the synthesis of protein is increasing. So there is increase in protein synthesis, right? But it is inside in the cell. So increase in cellular synthesis of protein. So let us move towards the example of hypertrophy. See, whenever we talk about example in this chapter 1, there always should be mentioned, you should always mention whether what are the example of physiological example and then the pathological example. So first example we are going to deal, which is physiological example, right? So physiological example, yeah, we just saw it is pregnant uterus. Okay, so uterine muscle is going into hypertrophy and hyperplasia. So hypertrophy is increasing in the size. The pregnant uterus muscles are increasing in size. And then we have pathological example. So what are the example? What is a pathological example for hypertrophy? It is a cardiac enlargement. Cardiac enlargement to what? To valve defect. So let us see what happens when there is a defected valve. So these are the 4 chambers of heart. Atrium, we have 2 atrium, and then we have 2 ventricles, right? And in between those we have valves. Okay, so whenever there is emptying of atrium into the ventricle, the valves open, and after some time those valves closes. Okay, but whenever we have valve defect, which is there is in what happens in valve defect is that those valves fail to close completely. Okay, so whenever they fails to close completely, there is some amount of regurgitation in the ventricle, where there should be stoppage of blood flow into ventricle. In that here what is happening is there is regurgitation. So because of those constant regurgitation and pressure applied by that reversed flow of blood, the muscles of this ventricle will undergo hypertrophy. Okay, and this hypertrophy will lead to the enlargement of ventricle. Okay, which in turn leads to enlargement of heart. Okay, there is increased size of heart. So this is what you understand by